Welcome to the MedSearch. Today we are going to talk about Raynaud's phenomenon. Raynaud's phenomenon results from an exaggerated vasoconstriction of arteries and arterioles in the extremities, particularly on the fingers, toes, and sometimes on the nose, earlobes, and lips. This is usually precipitated by cold and relieved by heat, and it affects 5% of the population and mostly women. This disorder is usually bilateral and the fingers are affected more commonly than toes. The index finger, middle finger and the ring finger are the most commonly affected fingers and the thumb is often spared. So let's take a quick look at this picture of Raynaud's phenomenon, and as you can see, some of the digits on the hand has become very pale and there's bluish discoloration. And this is what we call as white, blue, red changes. So the first change of color is white or pallor. This occurs when the blood vessels are constricted and the blood supply to the digits are impaired. And because of that, they will turn white and become incapable of fine movements because of the lacking blood supply. The second color change is cyanosis, and this is the blue attack. Because of the excessive vasoconstriction, there's not enough blood getting into the tissue and it can cause ischemia. The capillaries will then dilate and fill with slowly flowing deoxygenated blood, resulting in the digits to become swollen and dusky. This is when the fingers get a bluish cyanotic color. And as the attack is passing off, the arterioles will relax, the oxygenated blood will return into these dilated capillaries, so the digits will become red. So this is due to the reperfusion, and here the digits will become more and more erythematous. So the condition is recognized by the characteristic sequence of blanching, dusky cyanosis and red engorgement, often accompanied by pain. The duration of this attack is variable, but they can sometimes last for hours, and it will start with one finger and then spread symmetrically on both hands. Numbness, a burning sensation, and severe pain can occur as the fingers are warming up. In patients who are having this disease for a very long time, they can develop infarction and digital loss. Raynaud's phenomenon can occur due to primary or secondary causes. Primary Raynaud's phenomenon is caused by an exaggerated central and local vasomotor responses to cold and emotion. It affects 3 to 5% of the population, and the onset is usually early on life, between the ages of 15 to 30, and most commonly affected people are the young women. In chronic cases, they can develop atrophy of the skin, subcutaneous tissues and muscles. However, ulceration and gangrene is quite rare. Secondary Raynaud's occur due to a vascular insufficiency because of an arterial disease caused by another entity like SLE, scleroderma, Berger's disease, atherosclerosis, occupations that involve the use of vibrating devices, drugs and smoking. Drugs are also a major category in the course of secondary Raynaud's, and some of these drugs include cocaine, nicotine, sympathomimetics and beta blockers. So what are the risk factors associated with this condition? Cold temperatures, stress, young females and family history. Individuals with other family members who has Raynaud's have a higher likelihood of having Raynaud's themselves, and if they live in colder climates, they can develop larger and exaggerated and very frequent presentations of Raynaud's phenomenon because cold temperature itself is one of the triggers of this condition. So how do we diagnose? The diagnosis of Raynaud's is not very straightforward and it's mostly based on the history. So we can ask if they have any color changes on their fingers, toes and other areas when they're exposed to cold and stressful conditions, and whether this color change would be from white, blue to red, and when that attack occurs, if the patient has any pain, numbness and paresthesia. We also have to assess for other associated conditions like SLE, scleroderma, and we have to assess if this is a primary and secondary cause of Raynaud's. So when it comes to management, we have to avoid the trigger, that is the cold temperatures, trauma-inducing vibrating devices, medications like beta blockers and cocaine. We also have to advise them to avoid smoking and to reduce stress, as these are very well-known triggering factors of this disease. Patients should also avoid cold provocation by wearing gloves and warm clothes, and they can also use hand warmers. We have to keep in mind to avoid pulp and nail bed infections. When it comes to pharmacological approach, we can use oral vasodilators like calcium channel blockers, for example, amlodipine, nifedipine, ACE inhibitors, and angiotensin receptor blockers like losartan. In severe cases, parenteral vasodilators like prostacyclin analogs and calcitonin gene-related peptide can be used. A lumbar sympathectomy can help to relieve the foot symptoms. There's also another approach called radical microarteriolysis or digital sympathectomy. This can be used when the individual's fingers or toes are severely ischemic. So I hope you guys learned something about Raynaud's phenomenon today. So you can support my channel by simply clicking the like button, commenting and subscribing. I'll see you again next week with another interesting topic just like this. Until then, goodbye.